I am Dr. Sai Kalyan. I am consultant neurosurgeon in AAG Hospitals, Gachibowli. I am a brain and spine surgeon. Today we keep hearing about majority of the people who come with low back pain. Low back pain has become the commonest problems in nowadays in each and every individual. So this low back pain is seen right from adolescents to elderly people. Initially in olden days we used to see our grandmothers or grandfathers used to complain of low backache, but nowadays it has become common in each and every individual, starting from the college going students to age old people. So there are different causes for low back pain, and most of the low back pain is called as a mechanical back pain. And other types of the causes for low back pain are, it can be because of disc herniation, it can be because of disc bulge, it can be because of ligamentum flavum hypertrophy, it can be because of arthropathy of the joint, and it can be because of the slipping of the vertebral body over the one another, which we call as spondylolisthesis. So how does the patient present with? The patient generally have a low back pain, and this low back pain will be generally radiating to any one of the limbs. And other thing is neurogenic claudication. Neurogenic claudication means the patient will walk to certain distance, and after walking to certain distance they develop tingling, numbness and heaviness in both the limbs. So this is called as neurogenic claudication. Other thing we call is that the instability pain. In the instability pain, the patient finds difficult from getting up from sitting position, all these things. So when to consult a doctor? When the patients are having the symptoms, the 4 set symptoms which I have told earlier are serious and they are hampering the daily quality of life, they are disturbing the sleep of the patient, immediately you need to consult the doctor. So what are the investigations which are performed? So once you consult the neurosurgeon or a spine surgeon, they are going to do a set of tests, that is a neurological examination will be done, followed by a spinal examination. After this, based on the symptoms and signs, the neurosurgeon is going to order for investigations. The basic investigations being X-ray, we call it as a dynamic X-rays as well, followed by MRI of the lumbosacral spine. And this X-ray and lumbosacral spine, along with the symptoms and signs, give a proper clue to us. And there are 3 types. After seeing the MRI, after seeing the X-ray, most of the patients they can be managed depending upon the disease as medical and surgical. So medically the patients are encouraged to take the medications on a regular basis, and they are supposed to take rest for a couple of days. And once the pain has subsided, we need to start with the proper physical therapy under supervision. So the patient has to consult a physical therapist. They are going to tell the patient regarding the set of set of the exercises which they are supposed to do. So this has to be done under supervision and they have to continue it. So the concept nowadays is not taking rest for long time. Taking rest for long time was in the latest concept is early ambulation. That is, the patient is made to walk early and go back to the work early by giving medication. And once after giving the medication, the pain subsides. After the pain subsides, they are supposed to start with the physical therapy, that is physiotherapy. And they are supposed to do the back strengthening exercises, that is isotonic and isometric exercises. And the patients who require surgery, there are different types of surgery. Initially they used to feel, we used to hear, there are myths that post spinal surgery the patient is going to become paralyzed, they are unable to pass the urine, they can't get back to their work, they become bedridden. But the truth is that with the advent of technology and techniques, the spine morbidity has become very, very less. So nowadays we are doing spine surgeries under microscope and endoscope, and hardly we find the incision. The suture line is hardly less than 1 inch, and the concept is we make the patient ambulate very early, and the discharge, we are going to discharge the patient within 2 days, and they are back to their work within 1 week after the surgery. So nowadays the spine surgery complications have also become very, very, very less, or it can be negligible. So one has to realize that spine surgeries are not dangerous. In expert hands and with the advent of technology and techniques, the spine outcomes, the spine post spinal surgery outcomes are marvelous. Thank you.